Hello friends, this is Dr. Anshul Bansal. I am again joining you on the Unacademy platform to guide you through your studies in orthopedics so that you can crack NEET PG. We'll focus this month on NEET PG 2021 that is scheduled in the next month in September. Okay, I'm currently working as an orthopedic house surgeon in SMS Hospital and have cracked the NEET PG exam in 2020, that is in the last year only. Okay, in this today's session, I'll guide you to how to prepare in the last month. I'll tell you what to do, what not to do, according to my experience. Okay, and I'll tell you about the important topics in the orthopedics subjects. Okay, so we'll start this session quickly. Before starting the session, I would like to tell you in short about our subscription plans available at the Unacademy for NEET PG. First is the Plus subscription, in which you get daily live classes, live tests and quizzes, a structured courses in a strategic manner, and an unlimited access to all our Q banks and video lectures. Second is the Iconic subscription, in which you will get the prep letter, all of its Q bank, video lectures, and rapid revision courses, along with the things that I have mentioned earlier. You will get in Unacademy live batch wise classes, live tests and quizzes, and hard copies of our notes. Okay, you can apply for these subscriptions using this referral code to get extra 10% off. We have started rapid revision courses for this year's NEET PG examination also. Okay, and we have started a integrated clinical batch for this year's NEET PG examination also. You can use this code to get extra 10% off for 3-year batch courses for MBBS students, and for the coming next aspirants. We have started the batch dedicated for that also, and we have started a batch dedicated for the FMG graduates for the MCA examinations also, and you can use this code. We are also running a limited time period offer, in which if you buy any subscription of 12 months, you will get 2 months of it free, and you can use this code to get extra 10% off. And I would like you to suggest to buy plans of higher duration for longer durations. As you can see, the cost per month decreases significantly if you do so. And please attend our special classes. There is a very special features in this, like you will get live classroom like a feel. You can interact with your educators through polls, or you can raise your hand and clear your doubts वहीं का वहीं. You will never miss a class because we'll notify you. You will get the lecture notes, as well as you can see them anytime, anywhere on your Unacademy mobile application. We are also running a bugs bounty program, in which if you find any inappropriate content in slides of any of our educators, you can contact our team, and if it is found correct, you can win exciting offers and prizes. Okay, so let's start. First of all, what are the common mistakes you should avoid in this year's NEET PG examination? The common mistakes that you should avoid are छोटी छोटी चीजें हैं that you should keep in mind. Reach the examination center on time. Okay, just before the scheduled time. मैप्स में या फिर लोकेशन एग्जैक्टली 1 या 2 दिन पहले जस्ट पॉइंट आउट कि हाँ यही सेम लोकेशन है. एंड जो आपके एडमिट कार्ड्स है, गेट अ प्रिंट आउट ऑफ देम अर्लियर ओनली. स्टे पॉजिटिव, स्टे ऑप्टिमिस्टिक, यू नो एवरीथिंग, है ना. एंड जैसी हालत तुम्हारी है वैसी हालत हर बच्चे की है, मेरी भी वैसी ही थी. इनफैक्ट आई वॉज गेटिंग palpitations, but yes, अंदर से I was very optimistic. Okay, so and have a good nice sleep before 1 or 2 days. Say he good night sleep at least 6 to 8 hours. Before sleep, get healthy food, and before going to the exam, take a light breakfast. Don't take too much heavy, otherwise you will feel sleepy. Okay, and start your examinations with a good mindset. अगर starting में you get difficult questions और एक bunch of question का set, 5 to 6 लगातार bunch of question का set you will get in the examinations, मेरे भी आया था. है ना, एंड यू फील कि यार मेरे को तो हवा ही नहीं लग रही इन क्वेश्चंस में, एंड अगर वो स्टार्टिंग में ही आ जाए, डोंट पैनिक. ईच क्वेश्चन पेपर हैव अ बंच ऑफ क्वेश्चंस जो किसी ना किसी के लिए डिफिकल्ट होते हैं. ओके, एंड सबसे इम्पॉर्टेंट बात, रीड द क्वेश्चंस वेरी वेरी केयरफुली, वेरी पेशेंटली. भले ही तुम्हें क्वेश्चन की 2 लाइन से या ऑप्शंस देखते ही पता चल गया यार ये तो मैंने पढ़ा है, ये मेरे को आता है, बट स्टिल रीड देम वेरी केयरफुली. रीड ऑल द ऑप्शंस, सारे ऑप्शंस रीड करने हैं, वेदर you know कि first one is the correct, but still read the question and the options. And सबसे important, count for and be vigilant for words like accept, not, incorrect, not true. ये टाइप के जो वर्ड्स होते हैं क्वेश्चंस में, प्लीज बी विजिलेंट ऑन देम. एंड अगर कोई क्वेश्चन नहीं आता है या यू आर वेरी कंफ्यूज बिटवीन टू ऑप्शंस, उस क्वेश्चन पे ज़्यादा टाइम स्पेंड मत करो. सेव इट फॉर लास्ट. एंड एक ऑप्शन आता है मार्क फॉर रिवीजन और मार्क फॉर लास्ट. तो मार्क सच क्वेश्चंस फॉर द लास्ट and attempt as many questions as you can. We'll discuss it later that out of 200, each of you should attempt at least 185 questions. This is sorry, the bare minimum. At least 185 questions सबको solve करने हैं, सबको mark करने ही हैं. Okay, and whenever you get a time during the break, or you feel like demotivated, or you feel like tired, take a deep breath. Okay, take out 30 seconds or 60 seconds for yourself. Take a deep breath, Anna. And just before the examination, like during this phase, don't change your source. Even आपको लगे कि यार ये source is better, don't ever change the main theory source of your exam, of your preparation. Almost 80 to 90% of the content on any platform is same, है ना. The educators and the coaching and all, they are just the 20 to 30% part of your NEET PG examination. मेजॉरिटी 70% मेहनत आपको ही करनी है. कोई भी एजुकेटर विल नॉट, कैन नॉट स्पून फीड यू. कुछ भी पढ़ा है, you have to go and revise that. Okay, so don't change the source. Your notes are the best source, the best. And one more important thing, कुछ भी नया अभी नहीं पढ़ना है. Don't read anything new. जो अभी तक you have read, just revise them. Do a lot of question practice. ठीक है, don't read anything new. Okay, like during my preparation also, I could not read one or two small subjects. And the basic and the most funny part is I left orthopedics, है ना. I left orthopedics. I could not read it. I even didn't open the book of orthopedics. Okay, then I took orthopedics only after cracking the exam. So still, I remember that there were 8 to 9 questions of orthopedics, and by just previous knowledge of my MBBS and just from the common sense and all, I got 5 to 6 correct. है ना. And I attempted all the questions of orthopedics and I got 5 to 6 correct. So common sense जो MBBS के time you have read, that will work. And like ortho I haven't read, but I did the questions of orthopedics in the GT exams, or then I read the theory of that questions also. So जो basic important क्वेश्चंस थे या बेसिक इंपॉर्टेंट टॉपिक्स थे ऑर्थोपेडिक्स के, आई हैड कवर्ड देम ऑलरेडी इन द फॉर्म ऑफ जीटीज और क्वेश्चंस. ओके, एंड द लास्ट 15 days keep them for the revision of volatile subjects, है ना. What I did, I took last 15 days for anatomy, okay, pharma, pharmacology, microbiology, and then ortho. Last 15 days save it for ortho also. Then surgery, important surgery parts, like in surgery also GIT is very vast and very big, and then you have the other surgery. And if you take 6 days for surgery ना, 3 days 3 to 4 days आपको GIT में लग जाएगा, जबकि weightage of GIT and the rest of the surgery is almost the same. Okay, so smart study है ना, go for smart study. Biochemistry is one of them. And I would suggest कि revision start करो, तो revision you should start for the first and second year subjects plus PSM, followed by the short subjects. Okay, and then obs gynae, surgery, etc. And I would like to suggest to go for the medicine in the last, because medicine ka 60% to 70% you could cover in all these. Okay, so and clinically correlate subjects by giving grand tests. Grand tests are very important. सबसे important बात, after giving any test, please see the solutions. Okay, assess yourself, count your marks, and see the solutions and read the explanation of every question. भले ही वो बहुत ही easy question हो, still you get 1 or 2 words that are new, yeah, that are high yielding. So read the explanation of every question. And also one more important thing, don't forget the wrong options. Okay, wrong options be you have to read, and you have to read the theory related to them also. Okay, and don't add too much information at the last time. Jo pada hai, that is more than sufficient. Okay, don't add more and more information that is new to you at the last time. Okay, and assess the tests that you give. During giving the test, you should assess yourself for the time management also. Okay, otherwise you will panic at the last time. Give every grand test like you are giving the exam, and formulate your method for the time management कि किस सेक्शन को कितना अमाउंट देना है. You get 3 sections, 1, 2 and 3, first year subjects, second year subjects, then the clinical subjects. Okay, so give yourself enough time for every section. Okay, so and what should you do? You should familiarize and review yourself with the included subjects in the modules. Okay, don't change your content or the basic theory at the last time. Okay, हर सब्जेक्ट का कुछ बेसिक पार्ट होता है, memorize them, because as you all know, अभी जो पैटर्न है that is more towards the basic and less towards the one liners. Okay, earlier out of 10 questions 7 to 8 used to be the one liners, but now only 4 to 5 are the one liners, rest are clinically correlated or they are on the basic theory. Okay, so don't forget the basic concept of each subject. Know your strengths and weaknesses. Everybody knows कि कौन सा subject उसके लिए बहुत अच्छा है, that they know very well. Like for me, I had a feeling that, and I always used to score very well in the first year second year subjects, especially I used to score very good in the forensics and PSM है ना. So I knew कि हाँ ये मेरे लिए easy, I will score good in them. Okay, and don't strain too much on complicated questions. ये मैंने आपको पहले ही बता दिया है. जो complicated लगे एक बार पढ़ो, give your answer and save it for review in the last. Okay, read the instructions and questions very carefully. Okay, and don't panic. Okay, if you get a bunch of 4 to 5 questions that you don't know. Okay, and don't waste time. If you can't answer the questions, you can skip, and बाद में you can get back to it. Okay, and if you are finished ahead of the time, review your answers. And what I used to do, I used to make 3 sets of answers है ना, जब भी पेपर देते टाइम. First, in for which I used to be confident na, and the second in which I had very less knowledge, या मतलब in देसी language you know ना कि ऊपर से ही निकल गया sort of है ना, but I could eliminate at least one option है ना, so I would save them for the last. And also I would mark some questions, the third group, in which जो आते हैं, जो नहीं आते हैं. एंड द थर्ड वाज रिव्यू फॉर द लास्ट, इन विच आई वाज कंफ्यूज फॉर only 2 options. Okay, so first go for these questions. आफ्टर सबसे पहले एक 200 क्वेश्चंस एक बार में कर लो है ना. देन एट द लास्ट फर्स्ट गो फॉर दीज क्वेश्चंस, टेक ओनली 30 to 40 seconds or na, give a calculated guess and go for the answer. Then go for the questions जो आपको हवा भी नहीं लगी है, and if you can eliminate one option, then you should go for the answer. Because अगर ऐसे मान लो 10 questions हैं and out of 10 you get 4 correct ना, है ना, so 3 into 4 और 3 करेक्ट मान लो, ओनली 3 करेक्ट, तो 3 into 4 is 12 plus and -7, so still you have +5 marks. Okay, so please attempt at least 180 to 190 questions. Okay, so and एक महीना बचा है, मतलब 40 days ऑलमोस्ट बचे हैं. Social media, Insta, Facebook and all, they are not going anywhere, they are with you. But this time it's the most precious time and it will never come back. Okay, your friends and all सब इधर ही है, कहीं नहीं जा रहे, and you will enjoy more with them and you'll enjoy your phone more if you have cracked the exam. Okay, so प्लीज थोड़ा सा कॉन्सेंट्रेट एंड फोकस है ना, एंड स्पेंड टाइम विथ योर फैमिली, हैव अ वॉक और लिसन टू म्यूजिक. लाइक ड्यूरिंग माई प्रिपरेशन आई एम अ नाइट स्टडी पर्सन. ओके, सो आई यूज टू स्टडी इन द नाइट, then around 5 I used to go for a morning walk with my headphones on, and during that time also I used to give some mini test, or I used to do questions while walking and listening music है ना. around 1 hour में, ज़्यादा नहीं, I used to do only 50 questions sort है ना. and yes, that was a good way to revise. You get a refreshing feeling also है ना, and there is some change. Okay, so do this. Okay, have multiple revisions. It is the best tip you can get with practicing grants test. And join an academy. On an academy we will guide you in this last month. We'll give you high yielding and important topics and tips and tricks of every subjects है ना. So don't panic, you'll do good. Practice questions to easily get through clinically correlated questions है ना. कोई भी बड़ा क्वेश्चन आ जाए 6 to 7 lines का, don't panic, read them patiently. They'll have 1 to 2 words or 1 to 2 um, information that will help you to make the diagnosis. Okay, and identify keywords in the questions that I have taught you. And one important thing, and this is my personal opinion and my personal experience. Okay, first thing is, don't लगाओ too much दिमाग. Okay, examiner को पता है you are an MBBS student, so he will frame question of a level of a MBBS graduate only. Okay, बेसिक बीमारीज, बेसिक डिजीजेज एंड जो बेसिक क्वेश्चंस होते हैं एंड बेसिक आंसर्स, वो आपसे वही जानना चाहता है. सो डोंट लगाओ टू मच दिमाग, डोंट गेट इनटू टू मच डीप थिंकिंग. एंड जो फर्स्ट, इफ यू आर कंफ्यूज ना, सो Just go with the first answer that clicked in your mind. Okay, so this is my personal experience and my personal um, thing that I would like to share with you. ज़्यादा दिमाग मत लगाना प्लीज, है ना? कोई भी क्लिनिकल क्वेश्चन होगा, यू विल गेट इनफ ऑफ इट. ओके, सॉरी, 1 minute. Sorry, my laptop was out of the battery. Okay, so, है ना? ज़्यादा दिमाग नहीं लगाना प्लीज. Then yes, image based questions, be it x-rays, be it pathology key slides, be it other image based or clinical test, or the CTs and MRIs. Okay, at least 50 to 100 images per day you have to look, and just look, है ना? Save them in your galleries. I always say them, जब भी मैं कोई image या x-ray आपको दिखाता हूँ, just give a screen, get a screenshot of that or save that image in your gallery जब भी आपको टाइम मिले. In fact, I used to do the same. Like I used to wait for the lunch or dinner, मेरी mom लेके आती थी, और I used to sit idle, so I used to just open my phone and go through the images, for 100 images, if you have seen them 4 to 5 times already, it will hardly take 30 to 40 minutes, it will hardly take half an hour for 100 minute images, just go through them, just see them, and it is a very fruitful and a very important exercise that you should do, ortho, patho, radiology, obs gynae, PSM, microanatomy, these are the subjects in which you'll get majority of your questions as image based. In fact, in every subject now you will get majority of the question either clinical or image based. Okay, and as I've told you and I'm repeating you again and again, at least attempt 180 to 190 questions. It is the bare minimum, Anna. It is the bare minimum. Okay, adjust your sleep cycle according to exam timings now only, है ना? अगर morning में exam है, so the late night sleepers and the night study करने वाले लोग like me, they get a little bit of problem. So at least 7 to 8 days पहले try to shift your routine, है ना? You try to sleep early. Okay, don't change your strategy or your notes now, है ना? Analyze yourself what works for you, being aggressive or conservative method of attempting papers. Okay, but at least 180 to 190 questions आपको करने ही हैं. Be optimistic, you know enough. Paper, if the paper is tough na, it's tough for everybody, and mind you, the tougher the paper gets, the chances of your selection increases, because पेपर टफ होगा वो आपके लिए नहीं, वो सबके लिए होगा, है ना? एंड द कट ऑफ विल गेट लो. ओके, एंड इजी पेपर में क्या होता है कि देयर इज वेरी हाई कंपटीशन इवन फॉर 1 mark ऑल्सो, है ना? एंड उसमें फिर बात ये आती है योर सिली मिस्टेक्स. ओके, योर सिली मिस्टेक्स विल डिसाइड योर रैंक, एंड silly mistake come जब होगी when you are clear from your mind, you are optimistic, and you are not panicking. Okay, so for the last 30 days make a rough schedule and timetable. Give at least one grand test per day or at least 4 to 5 per week, and I have told you कैसे देने हैं, क्या क्या चीज़ें करनी है. 50 images, or I'll tell you 100 images at least daily. Mini test whenever you get time. Okay, you should cover clinically important topics more. The more you'll give tests now, you'll also get an idea ki yaar which topics are more important in any subjects. Like if you give any test, any GT of ortho na, if there are 10 questions now, I bet you every time at least 2 to 3 questions you will get on bone tumors. Okay, so there are some topics in every subject there are that are very repetitive. Okay, revise volatile subjects just before the exams. I have told you what are the volatile subjects that you should revise at the last time. Okay, and this year cutoff is expected to be high because number of questions कम हो गए हैं. So so it is good in a way that you'll get enough time to solve questions. Okay, and cutoff, if it's the cutoff is high, it's not for you alone, it's for everybody. Okay, so in last 30 days just make a set like I used to do कि anatomy ortho surgery एक साथ, physiopatho medicine in single go, and like patho and medicine, hematology you study in both, but I used to study hematology from patho only, and just जो CML, AML and anemia, various type of anemia, I used to study from patho only, just that treatment thing and some clinical features I added them from the medicine. Okay, and physio, and if you study like in these set na, you'll get, you can easily correlate more and there are high chances that you'll not forget. Okay, ENT opthal साथ में ऑब्स गाइनी पीडिया, वैसे आई विल सजेस्ट टू रीड पीडिया विथ मेडिसिन. ओके, स्किन एनेस्थीसिया, रेडियो साइकेट्री, शॉर्ट सब्जेक्ट्स साथ में, पीएसएम फॉरेंसिक, फार्मा, माइक्रो बायोकेमिस्ट्री, ये साथ में. ओके, एंड प्लीज 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 study short subjects. Okay, they are very important and they are very high scoring. Okay, they are very high scoring. Like if you are revising now, skin, anesthesia, radio, psychiatry, forensic medicine, ortho, ENT, opthal. Okay, these are basically your short subjects 1, 2, 3, 4, 5, 6, 7, 8. And now these 8 subjects, I can guarantee you at least from these 8 subjects you will get 40 questions. And at least 40 questions you will get from these 8 subjects. And to revise these 8 subjects you need hardly 4 to 5 days. 4 to 5 days में you can revise and you can score for 40 to 50 subjects. Okay, and वहीं पे ही like medicine आपने ली, so medicine is so vast that for revision you will take 4 to 5 days, at least 3 to 4 days for medicine, and its weightage is 15 to 20 questions only. So be smart, focus on short subjects also, they are your high scoring subjects. Okay, don't stress, just do your best. Now just think, don't think about the result, just think about ki I will give my best. Okay, and you are amazing, you are brave and you are strong, and yes you are. Okay, seriously you are brave and you are strong because it's not easy to prepare for the examination which have already postponed 2 times and it is late like 9 months, है ना? So yes, you have done well abhi tak, just hold on for 40 more days. Okay, this will all over be this will all be over soon, and believe me, once this will be over and you enter your residency na, you'll enjoy, you'll basically see कि yes, what is medicine, what is medical field, you'll do lots of party, you'll make lots of friend and you'll enjoy just for 40 days, and then you'll enjoy your residency very much like I am enjoying, you know. I used to be very anxious in the last 1 month or so, you know, but still I did that. So please be optimistic. And here is some important topics in orthopedics that you should cover the last time. And don't worry, uh, in the last few days, I'll take short lectures on special classes as well as on YouTube live, where we'll cover the orthopedics के सबसे important topics and high yielding topics. Some important topics, general topics in orthopedics is Cobb's angle, pulled elbow, osteoporosis, tennis elbow, osteomyelitis, arthritis, different types of arthritis, ankylosing spondylitis, and in osteoporosis कौन सी investigations normal रहेगी, कौन से markers elevated रहेंगे. Okay, you get such type of questions. Bone tumors, the most high yielding topic for orthopedics is the bone tumors. I have a special class for bone tumors scheduled on 11th, that is on Wednesday, a special class, so see that class. Okay, now in lower limb fracture you have important hip dislocation, neck femur, IT femur, patella fracture, fracture of the calcaneum and ankle joint named fracture. See, अलग अलग अतरंगी नाम वाले fractures, at least 2 to 3 you will get with x-ray image or with clinical history, है ना. So just before the exam 4 to 5 days, just see the images, or you must have note down somewhere. I'll also give you a list around 10 days before the exam of such weird name fractures. Okay, so remember them, just ratify them at the last moment. And in the upper limb, dislocation, shoulder dislocation, humerus supracondylar, lateral condyle fracture, these are important, है ना. नाम वाले fractures like Montegia, Galeazzi, Coley, Smith, Wooler, Barton, है ना. Ronaldo, Boxer, scaphoid fracture is another important thing, है ना. And in metabolic bone diseases, most important is the osteoporosis. Other are rickets and scurvy. See, rickets and scurvy you will study in biochem also, na. You'll study them, I think, in patho, in short, in patho also, in medicine also, okay, in pedia also, okay. So एक जगह से अच्छे से पढ़ लो, and in other subjects just read them in 5 minutes and revise. Okay, osteopetrosis, Paget's disease, osteogenesis imperfecta, and all. Okay, now in spine you'll get less questions, but only जो अतरंगी नाम वाले questions and fractures and x-rays होते हैं उन पे questions ज़्यादा आते हैं, and we'll discuss them. Okay, in soft tissue, bursitis, painful arch syndrome, frozen shoulder, Sudeck's deformity, and the injuries of the ligament of ankle and knee. Okay, tennis elbow, and you have to differentiate it with golfer's elbow and pitcher's elbow. Decurvin synovitis, what is the test in this? Finkelstein test. Okay, and Achilles tendinitis. Okay, very important. And you get one liners, and you know कि इसमें क्या पूछ सकते हैं, because इन सब के बारे में max to max 20 to 25 lines you have to remember for each topic. That's it. Okay, so these this was my suggestions for you based on my experience. Okay, so just follow them if you like, है ना. And every student have its unique way to attempt the examination and to prepare for it, है ना. If you are comfortable with any other method, and if that is working for you ना, go ahead with that. ऐसे नहीं कि मैंने बोला है तो वही करना है. No, the thing that is working for you is the best. And if you have problem या आपको समझ नहीं आ रहा कि क्या करूं, then you can take my suggestions. Be happy, eat healthy, अच्छे से सोना है रोज, है ना. And study hard, just revise, do questions. Okay, and if कोई question गलत हो जाए या you don't click that thing at the time of giving test, don't get panic. सबके साथ होता है ना. You cannot get 200 out of 200 correct. No child can get that. Okay, so don't worry. Okay, you just need your one seat. You just need your one seat. Okay, so see you in the YouTube live session tomorrow. Today at 7 p.m. I have a YouTube live session on management of fractures. Okay, and as I've told you, very important bone tumors pay class we'll have on Wednesday, a special class. Just download the Unacademy app and subscribe to be a part of this class, and both are absolutely free. Okay, you can use this code to subscribe for any of our subscription packs. Okay, so I hope you liked the video. If you liked it, please like, share and subscribe. Study hard, stay happy, stay safe. Okay, bye bye.